solution. Patient decisions,
Four languages redesigned.
Yeah.
You got Spanish as well?
Yeah, just one. Well, and English.
Right, perfect. So
Excellent.
all right.
Okay.
So welcome to Paris. Welcome here for Doctors 2.0, Raphael.
Thank you.
In case you haven't heard of Raphael, you're missing a real treat. He's got some great TEDx talks, and we've been talking about the iPod Trauma Center, and he's been evangelizing the first surgery on Google Glass. And he's operated theatre in Maine. So Raphael, we have you here, and we really want to get some opinions on mHealth as part of the EyeforPharma planning for the event. And really, the first question is just how do you think mHealth solutions can provide payers and physicians to have a better understanding of the patient experience?
Well, I really think that the key is communication. I think that mHealth solutions allow you to better communicate and better connect. Patients with patients, patients with physicians, physicians with physicians. And by doing that, you improve the whole process. And that way you can just improve the experience. So I think that's a fair answer.
In your work as a surgeon, I mean, what's the shape that you think that this is going to take for the pharma industry? What are the benefits that pharma's going to feel through mHealth adoption and wider?
Yeah. Well, I think that the pharma is tough because obviously, it's an industry with a large amount of resources. Lots of money involved with pharma. You want to sell the product, but at the same time, I think that ethically, you want to sell a good product. And at the end, is the patient at the end and at the beginning. So you really want to get the patients to get better, to stay healthy, and to become healthy when they're not healthy. So. Pharma has the responsibility, I think, as widespread and as powerful as they are, to really drive this in a way, and at the end have a better outcome for everyone.
In terms of the engagement of the clinician, the payer, what's the sort of tip that you've got from being the first doing this stuff, and you've obviously gone through, you're an early adopter, so.
Absolutely. Well, I think that the key is to preach about it. I think that becoming an evangelist, a preacher, a someone who tells the story. I think that delivering the message. For example, TEDx. You mentioned TEDx. I've done 4 TEDx so far, and I think something like that, being in conferences like this, being able to deliver a message, not just to the physicians or providers, but to the patients, to the public in general, to the e-patients. I think that message will be heard, and once people know, people will demand, and the change will happen faster. That's engagement. I think that once you get patients involved, demanding something to be done, then that's it.
Yeah. Cool. The pharma industry's very much captured this idea that pharma's going to be smart pharmaceuticals. And we're already seeing with the convergence of the inseparability of an app and a medication prescription. Where diabetics can't live without their phone. On Malik very famously quoted on that. What do you think about that future of intelligent pharmaceuticals and how that's going to burn? What do you imagine? What do you displace?
I think that as technology develops exponentially, I think that the pharma industry is going to be radically altered, radically changed for the better. I think that if you think about pharmacogenomics, if you think about a self, quantified self, and the integration of that, I think the future is going to be brilliant. It's going to be amazing when you can maybe just by quantifying yourself and designing, personalizing the drugs to you, to your style of life, to your genomic material, and then becoming, the end product will be the right product for you. I think that if you think about the possibilities there, the sky is the limit.
I had a very thought-leading anatomy professor who told us start playing the Game Boy.
Yeah.
And as a surgeon working very, with the leading-edge minimally invasive surgery stuff, a lot of your industry looks like it's come from the computer game industry.
Yeah.
What do you think? How do you think the adoption of mHealth is going to work across different diseases, disease areas. So will we adopt, or will each individual disease area develop the same? So will diabetes be similar to, the management of other?
Well, I think that it's hard to. It's a tough question. I think that certainly the overall process, will be general. I think that as you improve communication, as you improve connectivity, and you allow better engagement and eventually, better outcomes, I think that you have to get somewhat disease or syndrome specific, but it's sort of a tough question to specifically answer. I think that every disease will have their own tweak to the process, but the overall process will be changed.
Pharma looks at this as saying, is it product or outcome first? What comes first for you? So as a surgeon, I'm thinking it's quite obvious what you're asking.
Well, yeah, I think patient the outcome is what really matters at the end. But I don't think that you can sometimes do it without the product. So it's not a continuum. It's not a sort of a vertical, but a horizontal in a way. At the end and at the beginning is the patient. So I gotta say the outcome.
So your focus on evangelizing this technology is because you're seeing it creating new outcomes, better outcomes.
Absolutely. I think that as you improve the process, as you communicate and connect better, you not maybe have more time, but you have better time, quality time with the patient. Even if it's less minutes, if those minutes are used just to connect with the patient, to really do what you're supposed to do as a physician, rather than doing stuff that you shouldn't have to be doing or wasting time doing when you have the patient in front of you. And that's where technology can help. It's not the technology, it's the idea on how to use the technology in a smart way. So I think it's very interesting.
The other thing was, recently we had a lot of speculation about AstraZeneca being taken over by Pfizer. How different do you think it might have been if a company like Samsung with a $10 billion R&D budget, or Apple or Google was in this? And do you think that, this is the new competitor for the pharmaceutical industry? These big players in pharma, are they going to get competitive threat from?
Yeah, I think so. It's certainly, when you have a powerful, a leader that can really push at least the first steps, push them to happen, and then everything else up to that is rolling down. So I think that they have a very important role for the change to happen.
Thanks very much, Raphael. Raphael's Twitter mark is RGZR.
No, it's ZGJR. ZGJR.
If you want to know where the leading stuff's happening in mobile health, get on there.
Thank you very much. Thank you.